Health starts long before illness in our families, homes, schools, and jobs. Many Coloradans experience barriers to good health due to interfering factors in their lives. These factors are social determinants of health and can make healthcare more challenging for healthcare providers and patients. Some examples of these include income, education, race, and ethnicity, but there are many more. In a typical healthcare appointment, there may be signs that a patient is struggling with challenging life circumstances, which may inhibit successful treatment. However, there are also many ways healthcare providers can help patients get the care they need, despite such challenges. Every visit is an opportunity to identify the social determinants affecting a patient's health and utilize creative solutions to help overcome those barriers.
Good morning.
Hi, I'm here for an appointment at 9 with Dr. Wilson.
All right. Let me see what I can do.
Transportation affects the health care of many Coloradans.
Looks like I can still get you in today. Next time, if you're more than 15 minutes late, we're going to have to reschedule.
Sorry about that.
22 out of 29 Colorado communities surveyed about their healthcare needs identified this as a major issue, causing late arrivals, missed appointments, and hesitancy to make follow-up appointments.
Transportation affects people's abilities to get to their doctor's offices on time and also to be able to stay for that appointment. So if you have to use the bus, you have to get a ride with a friend, it can really impact anybody's ability to actually even get there. It's not only important for the well visits and the kids to get their shots, but the sick ones have to come back to be seen again. Otherwise, it's incomplete care.
Lack of transportation is also one of the main reported reasons low-income patients may be forced to rely on more expensive care in the emergency room over managing their healthcare needs with a primary care provider.
All right. Go ahead and fill this out.
Okay, thanks.
Literacy and health literacy are also important social determinants of health. 10% of Colorado adults lack basic literacy skills, meaning they are unable to read and comprehend a simple block of text. This makes completing tasks like filling out forms, following written instructions, or locating an expiration date on prescriptions difficult.
Okay, ma'am. We can take you back now.
Additionally, studies suggest patient comprehension may be compromised if content exceeds a middle school reading level. Most medical information was found to be written between a high school and college graduate level.
I think the handout is a good thing, but it can also, we feel like we're covered as a provider by just being able to give this patient a handout. So actually talking to the patient about, so what do you want out of this appointment? What can we do for you? And then saying, here's this handout, and then going over it with them to be like, this is more for you at home, but right now, you're here, I'm here, what do you need to know? What can we do to improve your health outcomes?
Looking at your medical record, I really think it's important that we get your blood pressure under control, as well as your hyperlipidemia. The reason I mention that with an elevated blood pressure...
I really enjoy nursing, and the role of nurses is being the bridge for the patient, because sometimes they'll have a very long, what I think is a wonderful encounter with their provider, but when it's finished, they have no idea what just happened. And obviously they do, but they didn't get out of it what they needed. I had a patient today, and the medical student was saying, have you ever had an MI? The answer is yes, but the patient was like, no. Anybody in your family? No, even though he was in for a follow-up for an MI, which is a heart attack, a myocardial infarction, but they didn't ever say, do you have any problems with your heart? And so it's always nice to kind of step back and say, so what questions did you have for your provider? Where can we fill in those blanks?
Not speaking the same language further complicates literacy. 17% of Coloradans speak a language other than English, and of those, only 6% speak English very well. This interferes with the doctor's ability to successfully interact with the patient.
In our practice, we see mostly refugees from around the world. So often, even if there's an interpreter, there are still issues that arise. Sometimes the chief complaint of the patient, some of the interesting ones I hear are, my teeth are burning, or I have a fire inside. You're still getting a cultural barrier in terms of what the patient is meaning when they say these words. So when trying to explain to a patient what I'm talking about, I try to keep some amount of props in the office If I prescribe an inhaler, I can demonstrate with a model inhaler. One of the most fun examples I've found is Google Images. For example, you type in H. pylori in Google Images and instantly you have 100 pictures where you can click on and it shows the bacteria itself and the patient will get the picture real quick.
Income is a significant factor in a person's ability to access the healthcare system and stay healthy. 30% of Coloradan households live with incomes below $35,000. 13% of Coloradans did not see a doctor due to cost.
I wanted to check with you how you're doing on your medicines. How are you doing taking your medicines?
Well, I've been taking one, but I haven't been taking the others.
12% of Coloradans did not fill a prescription due to cost.
It's very important for we as pharmacists and for the providers of the patients as well to understand where the patients are coming from, maybe a little bit of their background and how they struggle with the affordability of their medications. That being said, maybe the providers would be a little more open then to providing a generic prescription versus a brand name prescription, and open to insurance suggestions of providing what they call prior authorizations or changing medications to something that would be on their formulary and would be a little less expensive for the patient.
I'd like to give you this prescription for your elevated cholesterol.
Patients with lower incomes have limited access to healthy food, quality housing, and other things that affect their health status.
Income is one of those invisible but yet really important obstacles to getting good care. I mean, there's the obvious obstacle of if you're low income and you don't have insurance, but there's the more overlooked issue of how does income affect every aspect of that person's life? And is it visible to the physician during the encounter or is it not? So you need to one, be able to ask the tough question of, are you going to have a hard time affording this medication? Or will you have a hard time getting yourself to see this specialist or affording their copay? Can you afford the time off from work to go to these treatments or to come back in for rechecks? And really have that heart-to-heart to know what they're capable of doing.
All of the different roadblocks to healthcare are magnified when a patient has a complex life and complex health needs, which can become a vicious cycle. Low-income Coloradans have fewer resources to manage their health care and are more likely to suffer from multiple chronic conditions than upper-income Coloradans. Then, things like missed appointments, confusion about care instructions, and unfilled prescriptions all contribute to a decline in health, which becomes even harder to manage.
One of the hallmarks of a complex patient is simply having more than one chronic illness. They have diabetes, hypertension, and thyroid disease. Layered on top of that, they may also have morbid obesity. Layered on top of that, they may also have limited resources, no insurance provider. Layered on top of that, they may also have mental health issues. As a clinician, as a physician, it really involves recognizing that no one person can take on 6 steps of change all at once, much less 10 or 15 or 20. So with all of these complexities, one of the most important things that we can help our patients with is being able to prioritize. And without that skill, caring for this population becomes very, very challenging.
The field of medicine is a science, but the practice of healthcare is an art that acknowledges the whole of the patient's life.
The question is, does having empathy for your patients allow you to take better care of them? And I think the answer is yes. Without empathy or without understanding or without putting yourself in their place, it's challenging to be able to provide good care. I mean, we're not here because we want to make a diagnosis. We're here because we want to make people healthy. And I think you gotta appreciate where people are coming from, what their abilities are, what resources they have, what community resources exist for them, and incorporate that into your patient management. And so it makes it more challenging, but it makes it more fulfilling because you can actually be more successful if you think this way.